Have you ever wondered how people develop pneumonia? Why does having pet birds, going on a cruise, or drinking excessive amounts of alcohol increase the risk? And can a simple viral infection like the flu turn into bacterial pneumonia? This is part 1 of our pneumonia series. Today, we'll explain how pneumonia develops and why some people are more at risk. What is pneumonia? Pneumonia affects the tiny air sacs in the lungs called alveoli. These are where oxygen moves from your lungs into your bloodstream and carbon dioxide moves out. During pneumonia, these air sacs become inflamed and may fill with fluid or pus. Although many people think of pneumonia as a single disease, there are actually several different types. And knowing which type someone has is important because the treatment can be completely different. Bacterial pneumonia is one of the most common forms in adults. It is often caused by bacteria such as Streptococcus pneumonia and is usually treated with antibiotics. Viral pneumonia is caused by viruses such as influenza or respiratory syncytial virus, also known as RSV. Treatment is usually supportive, although some viral infections may benefit from specific antiviral medications. Antibiotics are not effective against viruses. Another type is aspiration pneumonia. This occurs when food, saliva, stomach contents, or liquids accidentally enter the lungs instead of the stomach. There is also a group known as atypical pneumonia. It refers to infections caused by organisms such as Mycoplasma pneumonia, Chlamydia pneumonia, or Legionella pneumophila. These infections often produce symptoms that develop more gradually and may require different antibiotics from those used for typical bacterial pneumonia. Why do some people get pneumonia more easily? Have you ever wondered why one person recovers from a cold in a few days, while another develops pneumonia and ends up in hospital? The answer depends not only on the germ causing the infection, but also on how well your body's natural defenses are working. When those defenses are weakened, germs can invade the lungs more easily. One of the biggest risk factors is older age. As we get older, the immune system becomes less effective and the cough reflex may weaken. People with chronic lung diseases, such as COPD, asthma, or bronchiectasis, are also more susceptible because the lungs are already damaged or inflamed, making it easier for infections to take hold. Smoking is another major risk factor. Cigarette smoke damages lining of the respiratory tract. It also impairs the immune cells that help fight infection, increasing both the risk of developing pneumonia and the likelihood of severe disease. This is also why vaccination against influenza, COVID-19, and pneumococcal disease can reduce the risk of severe pneumonia in eligible people. One important but often overlooked risk factor is excessive alcohol use. Alcohol can reduce the body's ability to fight infection, weaken the cough reflex, and increase the chance of stomach contents entering the lungs, particularly if someone vomits or has reduced consciousness. This can lead to aspiration pneumonia, which often requires prompt medical treatment. Problems with swallowing, also known as dysphagia, are another significant risk factor. This commonly occurs after a stroke in people living with dementia, Parkinson's disease, or other neurological conditions. Instead of food or fluids going into the stomach, small amounts may enter the lungs repeatedly, introducing bacteria and causing pneumonia. Being hospitalized, especially requiring intensive care or mechanical ventilation, also increases the risk of developing pneumonia because more resistant bacteria may be present in healthcare settings. Certain chronic medical conditions and some medications that suppress the immune system, such as chemotherapy, long-term corticosteroids, or medications used after organ transplantation, can make it harder for the body to fight infection. Can your environment cause pneumonia? You may have heard that keeping birds can cause pneumonia. Is that actually true? The answer is yes, but only in certain situations, and it is relatively uncommon. When doctors assess someone with pneumonia, they don't just ask about symptoms. They also ask about travel, occupation, hobbies, recent exposures, and even whether you have pets. These questions can sometimes provide important clues about the organism causing the infection. One example is a condition called psittacosis, sometimes referred to as parrot fever. people may become infected after breathing in tiny particles from dried bird droppings, feathers, or respiratory secretions. This can occur when cleaning bird cages or handling infected birds. Although parrots and parakeets are most commonly associated with psittacosis, the infection has also been reported in pigeons, poultry, and other pet or wild birds. Fortunately, psittacosis is uncommon. Because the symptoms can resemble ordinary pneumonia, doctors consider it when someone has pneumonia together with a history of significant bird exposure. Symptoms may include fever, headache, muscle aches, dry cough, and shortness of breath. Some people may also feel unusually tired or develop more severe pneumonia requiring hospital treatment. Have you ever been asked whether you've recently stayed in a hotel, been on a cruise ship, or spent time in a large office building? This is because these environments can occasionally be associated with a type of pneumonia called Legionnaire's disease, which is caused by the bacterium Legionella pneumophila. Unlike most pneumonias, Legionella is not spread from person to person. Instead, people usually become infected by breathing in tiny droplets of contaminated water. Sources may include cooling towers, decorative fountains, hot tubs, or complex plumbing systems that have allowed the bacteria to grow. Although outbreaks are uncommon, they have been linked to hotels, cruise ships, hospitals, and other large buildings where water systems are not adequately maintained. Symptoms can be similar to other forms of pneumonia, including fever, cough, and shortness of breath. Can a viral infection become bacterial? Many people have experienced this situation. You catch what seems like a viral illness. After several days, you begin to feel better. Then suddenly your fever returns, your cough becomes worse, and you feel much more unwell. Does this mean the virus has turned into bacteria? The answer is no. A virus cannot change into bacteria because they are completely different types of organisms. However, a viral infection can make it easier for bacteria to cause a second infection in the lungs. This is known as a secondary bacterial pneumonia. When a virus infects the airways, it can damage the lining of the respiratory tract. At the same time, the body's immune defenses may be temporarily weakened. This creates an opportunity for bacteria that are already present in the nose or throat to multiply and spread into the lungs, causing bacterial pneumonia. So how can doctors tell the difference? Unfortunately, there is no single symptom that reliably distinguishes viral pneumonia from bacterial pneumonia. Both can cause fever, cough, shortness of breath, fatigue, and chest discomfort. Although some viral infections may develop more gradually, symptoms alone usually cannot reliably distinguish viral from bacterial pneumonia. Doctors look at the whole clinical picture. They consider clinical assessment, review chest x-rays if needed, and may perform blood tests or other investigations such as sputum cultures. Now that you understand how pneumonia develops, the next question is just as important. How do doctors know whether someone can recover safely at home or needs urgent hospital treatment? In Part 2, we'll explain how pneumonia is diagnosed, when antibiotics are really needed, and the warning signs that should never be ignored. Thank you for watching Medical Explained. If you found this video helpful, consider subscribing to Medical Explained for more evidence-based health information.